Welcome to part 2 of the Highland ED orientation video. This will be a virtual tour of the ED and a chance to locate the supplies and equipment you will need. The emergency department is divided into 4 areas: stations 1, 2, and 3, and fast track. Rotators will see patients only in the stations and not fast track. You will need your AHSID badge in order to enter the department. The first door on the left is the doctor's charting room. This is where we do our sign-outs, do charts, share our meals, and we have some supplies in the cabinets. People also affiliate with AHS programs can get fresh scrubs. The cabinet on the right has the long angiocaths for deep brachials, the intracavitary probe covers. There are also the transthoracic probe covers are located here, as well as the needle stick protocol packets for employees and source patients. The cabinet on the right has the blue and pink evaluation cards and the forms required for the HIV and hepatitis C studies. The 911 closet is just outside the doctor's charting room and has the airway bags and the med boxes for responding to code blues and code whites. Station 1 is the central hub of the department. The telemetry units are monitored here. We receive ALS ring downs. The Side 1 attending is in this area. The medicine team works in this area, and the charge nurse is located in the central part. Medical codes are done in rooms 5 and 6. There is a procedure cabinet in room 5 which has a transvenous pacemaker, a magnet, and other equipment that we use. The room 5 cabinet has the central line equipment as well as a Pyxis containing ACLS drugs and also the unit dose packets of benzocaine. Room 7 has all the equipment needed to do pediatric codes. This includes, we have a cart for neonatal resuscitation as well as older children. There is an ambient warmer and a scale just outside of room 7. In trauma room 8, we have the difficult airway cart, which contains LMAs, the King Vision System, CMAX, the flexible scopes, the cricothyrotomy kits, and the transtracheal jet ventilation kit, as well as other things. Check it out. All of these people are expecting the arrival of a level 1 trauma activation. You can see that the room is already very crowded, and rotators will not participate in level 1 activations. We do invite you to be involved in level 2 activations. Medical students can observe the trauma level 1s from the central part of the space between rooms 8 and rooms 9. This is a view of room 9 from that place. The ever so handy Doppler machine is located on the counter in room 8. This is essential for doing ABIs. The green cabinet outside of trauma room 9 has all the supplies you need to do a central line: sterile drapes, sterile gowns, and all the securing devices. The blue cabinet is equipment for suturing. Patients who are wheezing but are otherwise stable can receive nebulized treatments in the asthma lounge. As we enter Station 2, you can see that there is a clean utility room on the right, a staff bathroom on the left, the medication room, which we will use frequently. There's a key code. We'll give it to you when you arrive. The charting area for the nurses, and the clean utility room with many, many treasures. We'll talk about this in a minute. Rooms 20 through 22 are negative pressure rooms and are often used for respiratory isolation. There is a small aqua cart which has N95 masks and plaques. In the Station 2 medication room, you will find unit doses of bupivacaine and lidocaine, syringes of various sizes, as well as the appropriate needles. There is also a Pyxis in this room. The clean intracavitary probe covers and their containers are on the counter of the clean utility room. Below the counter are the Acept paracentesis collection bottles, as well as the extension tubing in the drawers. There are Foleys in this room. There are LP kits, thoracentesis kits. There are LP needles of various sizes. There are various extension tubings that are necessary. Extra staplers are here, as well as staple removers. The drawers also contain the podiatry kits. The point of care lab is located at the beginning of hallway 2. Inside there is a co-oximeter used by respiratory therapy, and the staff can use the area also to do bedside urinary pregnancy tests. In the drawers are stool Hemocolt slides and the equipment needed for stool culture and stool O&P. The hallway 2 closets contain supplies used by staff and also items needed by patients such as socks, cold packs, etc. Hallway 2 is considered part of Track B in Wellsoft. Room 27 in Hallway 2 has a bed which can be utilized for pelvic exams, ultrasound exams. The room is also sometimes used for isolation. The charge nurse office has a cabinet and a cart which keeps supplies that are normally stocked on the floor. It is also the location of pigtail catheters. You can find intracavitary probe covers here, as well as the eye care tonometry probe. The new ED anesthesia block cart is located in hallway 2, but moves around. Please check out the items in this new cart. The chronic wound care cart is also located in hallway 2 and has supplies for treating both wet and dry chronic wounds. Please use the screens to provide privacy for any patients you see in hallway 2. Hallway 2 also contains rooms 24, 25, and 26, as well as the ortho supply room off to the side. Many of these patients are involved in the swap process, but not always. The ortho supply room is next to bed 26 and contains crutches, walkers, canes, splints, slings, a splinting material, the cast saw with vacuum, and the rolling bucket, which is used to splint during traumas and at the bedside. The internal waiting room is for patients who have been seen and have been swapped out as they wait for lab results or an imaging study. 23 is where the swap nurses work. There is a purple cart at every station, and this cart contains the equipment needed to start IVs and to draw blood. This cart also contains the pre-dent number and band used to type and screen, type and cross for the blood bank. The last patient care area that medical students and rotators will see patients in is in Station 3. In this view, we have the internal waiting room. We're turning left. On the left is a room with beds 28 through 31. This is a view of the doctor and nurse's charting area. There is a clean utility room which has extra supplies including extra pelvic trays and anoscopes, bedpans. This is also the room that has the new GYN cart. Station 3 has its own blue suturing cart which contains materials needed to repair lacerations. This could include staples, this can include suturing supplies. There are jet irrigation kits and suturing kits. Room 40 is often referred to as the eye room because it has a slit lamp and the tonometer, but the blue cart has eye, dental, and ENT supplies. The Station 3 med room is located next to room 40 and has many supplies, including the ever-elusive methylene blue and unit dose benzocaine. As we turn the corner to the left and straight ahead are rooms related to the forensic examinations, and then rooms 42 and 43, which are pelvic room beds. There is also a pelvic room bed across the hall in room 44. The dirty utility room in Station 3 is where the used intracavitary probes and their containers are placed. This room also contains the microscope. We mostly use the microscope to look at wet mount slides. When you're finished looking at your slide, please turn off the microscope and dispose of your slide in the sharp box. The Fast Track cubicles and beds are staffed by mid-level practitioners and an assigned physician. Rotators and medical students do not generally see these patients unless the patient is transferred to the ED. This concludes Part 2. There's a lot of information, but it will become second nature after a few shifts. Please continue on to Part 3.